Welcome to the Registry Insider. I'm Bill Seifarth, the CEO and Executive Director for the National Registry of EMTs. And today we're talking with three educators from Eastern Kentucky University, talking about challenges and opportunities. So not just the problems, but the solutions for EMS educators nationally right now, as we're looking in the midst of a lot of transition post-pandemic. So joining me for this conversation today is Dr. Bill Young. He's program director here at EKU. He's also a COA site visitor and an MC board member. Also, Bryan Ericson from Tarrant County College in Fort Worth, Texas. He's a former NREMT president, is a site visitor, and program director for his program as well. And Dr. Paul Rosenberger. He's our content manager for our content team at the National Registry of EMTs. And collectively, these gentlemen have quite a bit of experience in the classroom and certainly developing with the curricula.
You just called us old guys.
Well, I didn't. I tried to avoid the word, but now that you've mentioned it. So, gentlemen, thank you for joining me for this conversation. You know, the timing of this, I think, is really important as we embark in some new chapters in the EMS history. You know, EMS is over 50 years old. National Registry just celebrated its 54th anniversary, and we've been around for a while. But there's been a lot of change. There's been a lot of evolution. And with that change, there's some new challenges facing EMS education. So I'd love to hear your perspectives. What are the biggest challenges facing EMS educators right now, and including program directors, anyone involved in the EMS education arena?
So, you know, Bill, I think one of the big challenges is what I call the killing extras. As a program director in particular, but as educators overall, I don't think anybody complains about what they have to do in the classroom. That's what we like, we enjoy. That's where, as an educator, regardless of whether it is in rural Kentucky or in suburban New York City, that's where we shine. That's where we draw energy from. I think one of the big challenges that we see right now is all the other material, as important as it is, that's coming in from different directions, coming in from our state offices of EMS, coming in from accreditation, coming in from our college or university administration. And so I think one of the things that we have to do as far as addressing that is making sure that we are vocal in a respectful manner to each one of those entities and say, wait a minute, part of the problem here is that I'm being overloaded. And nobody's being malicious about that. If the problem is each one of those entities don't talk to the other. So it's much like we talk about polypharmacy with patients. Right. When you've got three doctors and you're getting prescription coming in from multiple different areas. What we have to do is I think we have to advocate for ourselves to each one of those of saying, is this, number one, is it really going to benefit the student in making them a good paramedic? And number two, when we reach that capacity, we have to be willing to push back against that and say, you know, I have to make a decision here. What do you want me to do? What you know, we triage the areas that come in. What do you want me to do? Because I can't do all of it.
I'm going to jump on that too. I think some of the problems we're seeing in EMS education is almost self-inflicted wounds, right? Because one of the things about EMS, just in general, not just EMS educators, but as EMS educators, we're all EMS professionals. We all came up from the streets. We all did our ambulance time. We've all cared for patients, right? We've all done that. And so it's in our DNA to solve problems.
Yeah.
And so
say yes.
And say yes, absolutely. So we will go into a lab and get a cardboard box and some duct tape and some baling wire, and we'll whip up a simulator that just crushes it. And then meanwhile, our administration has no clue what we're doing, right? We only have one classroom. We're making it work. We always find solutions to problems that we don't share up the chain. When you start to communicate correctly to your administration and actually show the need, then all of a sudden you might start getting more resources, right? Now, secondary to that, I think one of the biggest challenges we're going to see in EMS is not necessarily the shortage, right? Everyone talks about an EMS shortage. There's a shortage of this, there's a shortage. I would argue there is not a shortage. I would argue we have allocation issues. I would argue that our students are going to places we never dreamt they would go before.
Oh, yeah.
Not everyone's coming in wanting to be a firefighter, paramedic. Not everyone's wanting to go work on an ambulance. I got folks going to the hospitals. But we're going to have a significant educator shortage.
Oh, absolutely.
Because right now, I'm just in my hometown in Fort Worth, a faculty member, if I bring a new faculty member in, let's say if I take somebody off the street with 10 years experience, a bachelor's degree, a nationally registered paramedic who wants to enter education, they have to take a significant pay cut to leave the field to come into an education setting. So, I mean, MedStar pays, I think, $20,000 more a year for a new graduate paramedic. So we're seeing the same thing in nursing, right? Nursing graduates leave nursing school making more money than their instructors. And so why would somebody of quality, right, would want to come in to be teaching? Because they're going to lose a significant part of their income and ability to care for themselves. So until we figure that out, and to speak to Bill's point with administration, as a program director, COA is the least of my problems. People go, oh my God,
same here.
Everyone likes to put the blame on accreditation. Everyone likes to put the blame on the registry. But honestly, my biggest challenge sometimes is me, right? And not actually advocating correctly for myself. I have to advocate to my administration. I have to advocate to my state office. I have to advocate for my program and my students to get the resources that I need. And once I start to advocate correctly, and you demonstrate to your administrators the numbers, right? Because remember, your administrators don't really care about, say maybe just that your paramedics, great. Oh, that's awesome. But how many graduates are you producing?
Absolutely.
What's your retention rates? How many cohorts a year are you doing? How many employers are interfacing with your programs? Those are the things that your administration wants to see in that community involvement with your program. So in a lot of ways, that's just my problem is necessarily just making sure that I'm communicating.
One solution for that, Bryan, is my department chair is the guy that I really, really admire and respect. He said, because we have an extremely active social media presence from our program here. And he says, make sure we tag everybody in the chain of command within the university, all the way up to and including the president, so that at least from that perspective, people know that over here, in the grand scheme of things, we're a small program in a fairly large university. We've got about 17,000 students or so. But the amount of work and the amount of accomplishment that comes from our students and from our faculty here is really notable, and people need to be aware of that. And this is, again, one of those situations where the squeaky wheel gets the grease.
So be loud and proud about the accomplishments.
Absolutely. And be proud, because even I've struggled with this. I mean, this is new for me. And one of the things my dean does is he wants to make sure we are broadcasting our successes. And that's something I was like, I don't got time for that. I don't have time to broadcast the success. I don't got time. I don't want to share an accolade. I'm busy. Wait a minute. If I don't do that, then
everything you guys have said, I mean, I don't have anything to add to this, but when I think about this, you think about the personnel that it takes to deliver a course. You've got a program director, a medical director, you have faculty, clinical field coordinators, preceptors, all of those people. And to get those resources, if I came to you and said I need a new employee, you're going to ask me why.
Yeah, I'm going to ask you to show me the data.
Yep.
Show me the data.
Why?
Right.
And so these are things that not only as educators, I mean, we have to educate our students and do the best we can with that, develop curriculum and all that kind of stuff, but we're also business managers.
Yep.
And so
100%.
So that's the skill that we have to develop and
sharpen that sword a little bit.
Yep. Take that, just as you said, take that back to our administrations, to our community, and make sure they understand how important what we do is.
Bill and I are unique both in that we're relatively large programs, right? And so we're bigger programs. And so, we have three, and for example, I can have up to 4 paramedic cohorts running at one time. And a lot of programs are small. So there's the bulk of programs across the nation are smaller programs.
Less than 10 is what I see.
Yeah, less than 10 a lot.
Visits.
I see a lot of site visits are less than 10. There's a lot of colleges that only put out 12 to 14 paramedics a year. And I would argue that sometimes it's the smaller programs have to work even harder to advocate for themselves.
Because they don't have the resources.
They don't get the resources because the administration looks at them and says, well, there's only 12 students a year, right? And well, wait a minute. What does it take to get those 12 students where I need to get them, right? And I need that resources. I need those helps to be able to make sure I equip my students to be successful.
So one thing I'm hearing so far as a theme is dealing with your administrations as sometimes a challenge. But yet to combat that, the solution is be loud and proud, social media, get the word out there so that there's attention drawn to it.
Metrics.
Key metrics. The other thing I was going to say is data.
Data.
Gather the data and show the need so that it can be justified to get the resources needed to program. However, on the flip side of that, and there's been some publications through our National Registry's research team to further validate this, but there's a lot of paramedic programs that are under 10, 12 students.
Yeah.
And that becomes challenging. That is a challenge in and of itself because it's hard to justify when you have such small students. So let's talk about that a little further. What can a bulk of these programs in our country that are small numbers, what can they do then if they can't justify with numbers, not with the numbers or with the social media posts? What other things can they do to help beefing up their programs?
I think of the national organizations that have tools and resources for those educators. I mean, National Association of EMS Educators is a organization that supports educators. And, join those organizations and be vocal and say, these are our needs for our community, because they don't always have that resource of a program director, a medical director, full-time faculty, a clinical coordinator, field coordinator, preceptors, and all that. And so that's usually one or two people in these really small programs working really, really hard.
Right.
So why can't they join an organization and support one another?
And I think that's key, Paul, because many times what happens is we're sitting here in our programs, large or small, and we become isolated and we begin to look inward and we begin to think nobody understands what I'm going through. Trust me, there's a bunch of people around the country that do understand.
Sure.
So networking within those national organizations, joining, there's an incredible Google group out there for paramedic educators. And I love this because there's no ego. It's kind of like when I put a question out, even if it is a basic rudimentary question that
in 7, 8 resources like that. Yeah, I love that.
Instantly, people begin sending things in. How can I help? And that's what we have to do, because again, now if shared misery is still misery, but it lessens the burden of it when I understand that we have people in Texas, we have people in Ohio, we have people around the country that can understand how I am. And I can go to them and say, well, how did you deal with this?
Well, and I'd argue that those people in these organizations are really good people.
They are good people.
And they want to help each other because they understand those burdens. And you reach out to me, I'm going to help you.
Absolutely. Yeah. The worst case scenario is what? We make good paramedics. We help each other make good paramedics, right? If I can share any resources I can, but I'm going to say something now that's probably not going to be very popular. And I may
Thanks for the warning.
I know. I'm just going to warn you that, but because here's the deal. When you look at EMS education and the kind of the approach that we've taken historically over the years, for whatever reason, we have it in the collective mind of the hive. Every community, every town needs an EMS program, right? So you can have 5 communities within 50 miles of each other, and every one of those communities has to have their own program. Is that the best utilization of those in particular resources? We don't have a medical school in every town. We don't have a nursing school in every town. Every college is unique and different, meets the needs. But for some reason, we have to be able to train our paramedics in our garage locally. We can't send them to a school.
Right.
And until we start to embrace a full education model that actually requires education, not training, that, we have to send people off to school to get this education so they can be equipped to then function. We're going to see a lot of programs really, really struggling because no matter how hard they try to make it work, no matter how much money they bring to bear, if you're in a community, and I've seen this, I'm sure you've seen it as a site visitor, you're in a community where there's one hospital, and that one hospital is trying to support that local college and they support all the programs, and it's taking those paramedic students almost 2 years to get their clinicals because they don't get enough exposure to patients when they could have gone 50 miles to a really big town with a really big hospital and finish that.
Well, let's take that out on a much larger scale. I was at a CreditCon last week, and I talked to the program director of the paramedic program in Anchorage, Alaska. They send their folks down to the lower 48 because they can't get those experiences there. And then they come back. Well, who bears that expense? Well, the student does. It's part of their education. Now, I'm not, minimizing that is a huge expense. But again, when I'm in that cardiac age, that prime cardiac age. So when I have my MI, I want to be able to say, thank goodness you're here, because I know that you're a competent paramedic, instead of, oh my goodness, who's next up? Right. Who else can I call?
And along those lines, I think we think about challenges to education, right? Mm-hmm. And so one of my greatest challenges to the growth of my program is clinical space.
Yes.
So I'm competing, not only am I competing with nursing and PA and medical students and all the other sundry health professions and allied professions, I'm also competing with multiple programs that come to my community to get their clinicals, because I'm resource rich. I get that.
But I assume you have a collaborative relationship with those other allied health programs.
Well, and within the college, yes.
Yeah.
So within my allied health programs, yes. But again, I still have 5 or 6 nursing programs from different colleges that we don't collaborate well with. The nurses get the nurses stuff, But
now, see, that's one of the things I'm proud about here, is the fact within the Central Kentucky area, we have a similar issue where, they're sending students into Lexington, but we're beginning to see each other not as threats, but as partners to help raise each other up. And I'm really excited about fleshing that out and building that up as these different programs. One is over in Frankfurt Fire, one's up at Bluegrass, and then we have ours. And so as we come in, it's kind of like, how can we help each other? And it takes some time and it takes some communication, but I think it's going to turn out a better product.
One thing we're trying to do, it's very much in the infancy stages now, as I'm working with other program directors in the paramedic side, and we're unifying and uniform our preceptor training process, so that we can go to MedStar, for example, or Fort Worth, and we provide one preceptor training program for all 4 or 5 different programs, so that we can accommodate that. But again, then I'm also then limited by, I can't put students on those ambulances now because I'm also helping with 4 of the programs.
Sure.
And that's fine. And we need to help those programs. We need to work with each other, but we're going to get to a point where we're going to use up all the resources and not have a way to make the students. And then we can't pay a person to come in and be an educator and actually have make a living that's going to be, on par with what they were doing in the clinical side of their job. It's going to be really hard to recruit folks that want to teach, that really bring something to the table.
Agree.
Remember, because back in the day, you hurt your back. What'd you do? You got sent to training.
Yep.
Yeah. You can't lift. Well, time to go start teaching CE. Yep. Well, we can't do that anymore because education has become so much more complex. Yeah. Yeah. It's much more, you have to be an educator.
Yes.
And have to understand education to teach paramedics now. It's like, what? I just can't. I'm a good paramedic. I should be a good teacher. Not necessarily. I know some great paramedics that are horrible teachers. I saw some fantastic paramedic educators that might not be the best clinicians, but they're excellent educators. So there's so many variables there, but there's resources and just communication and sharing the wins, and we just got to keep advocating for our programs for success.
I think I was going to go through and just succinctly summarize some of the challenges, but the highlights as far as the opportunities or the solutions. I think you just did. Collaboration as one thing. Mentoring is something we didn't talk much about. I think with the Listler, a lot of states I'm noticing across the country are starting to mentor other programs that aren't as successful or well off, especially given the small numbers of students that are enrolled in a lot of these programs. And then you said, making sure that you're visible, being loud and proud, so your administration knows about it, social media, reaching out to others through the listservs is another thing, and collaboration
and metrics,
keeping the metrics,
data
measure.
And one of the things I want to tap onto what he said was, when we go to the classroom, we probably were a pretty good clinician in the field, but now we're in a whole new arena.
Yep.
And now we're educators. With clinical experience and knowledge. And so there's development that has to occur in that part of it as well.
Yep.
It's not good enough just to be a great paramedic.
Right.
You got to be a really great educator too.
Well, and then you also, really part of that big communication, right? You have to be a good communicator because your administrators don't understand that you have COA rule, You've got state EMS office rules. You might have local EMS office rules. And then you're going to have NREMT rules and all the things you have to do to make sure that the boxes you have to check and everything that you have to do to make sure those students are eligible to go take that
That's
test.
right. Become that business manager.
He's right. You become like a business manager. Yeah.
Yep.
And, some for sort of large programs, I think the director needs to be a director and not be in the classroom as much, and that's a challenge for some educators because it's like the same thing when we went to education. You had one foot in the clinic and one foot on the educator side, and slowly you took your foot out of the clinical side, you came over to the educator side. And now I'm in that position where I'm at slowly going from the educator side to a full-time administrator role. And I've struggled with leaving the classroom because I enjoy it. That's my happy place, right?
Yeah.
I like to talk. Surprise. But but it's the evolution and being prepared for that. And I think as educators, I think across the board, if you're new in this, you're new in education, keep your head up. Don't lose hope.
And
reach out for help. Always ask for help. Find that mentor. I guarantee you there's somebody who's been there, done that, has skinned that cat.
Yeah, this is not the first
right. I tell people all the time that I'm always looking for the next way to skin a cat. I'm like 502 ways to skin a cat. So I'm looking for my 503rd, but there's always a different way to do it. And there's great resources available to folks to get that done. And then hopefully the issues with pay and equity and things like that will come back around. But I mean, nurses is dealing with the same thing. Every health profession is dealing with the same thing.
It's not just EMS.
So it's not just the EMS thing. So
it's good. Well, gentlemen, thank you for joining me for this conversation. Certainly, we have a lot of challenges in EMS education.
We do.
But there's some solutions and some opportunities. And thank you for sharing your practical advice and your experience with our EMS community. So thank you also for joining us. And as always, stay safe. Thank you for joining us for this episode. If you wouldn't mind, please click the like and subscribe buttons, as well as the notifications so you can get notifications of upcoming episodes. Also, for the latest and greatest happenings of the National Registry, feel free to go to nremt.org. Thank you very much. And again, stay safe.